Hi, this is the assessment comparison analysis from Spce 689.815, fall 2024 with Kelsey Brown, Griffin Coaster, Carly Craig, Maggie Barbie, and Omar Velez. The outline of this presentation goes, we are going to introduce our client. We will review the ABLES-R, what it is, what does it measure, and how we will use it. We will review the VB map, what it is, how does it measure, and how will we use it. How are the ABLES-R and VB map different, and what we will do next. So client introduction. This is a 4-year-old male who was diagnosed with autism level 1 within the last year. We will call him Daniel. Daniel has some babbling. He's been working with speech therapy for a little over a year. They've made some progress with sign, and he will sign at random times, but it's not at a consistent rate. He will scream and point to communicate, but is ineffective at forming words at this current level. Daniel has been receiving ABA services for about 8 months, and we have seen some progress in the increase in sign and some sound approximations. He will also be attending daycare Tuesday and Thursday mornings.
The first assessment tool that we'll be looking at is called the ABLES-R. It stands for the Assessment of Basic Language and Learning Skills. It's internationally recognized as an assessment tool. It's been shown to be useful in guiding teaching for critical learner skills for children with autism. Some of its components include 25 different skill areas, and of these skill areas, there's about 544 different items, and these approach subjects like language, social interaction, self-help, and motor skills. It is primarily an assessment tool, and it's presented in a gridded format and uses direct forms of measurement, which allow for easy interpretation by both us, the practitioners, and caregivers that would also like to look at it. Additionally, it's advertised as a curriculum guide, so we can take the results of the assessment and directly apply them to determine what sort of curriculum or programs that we can implement. Additionally, there's skills tracking systems, which are used for specific the monitoring of progress for specific skills. The age range for ABLES-R is between 2 and 6 years old, but it has been used up to 12 years old. Some of the skills that are assessed are receptive and expressive language skills, motor skills, social, academic, and self-help skills. The data collection results are presented in a grid format, so it provides a nice summary of the different skill areas, and it contains direct forms of data collection. Of the 544 items that are in the ABLES-R, only about 395 of them are considered to be necessary, and reducing it to this number could also allow for a more reasonable time commitment to the assessment. As far as its reliability of its implementation, some studies have resulted in a 95% score, which is considered excellent among assessment tools. The ABLES-R is primarily an assessment tool, and so we'll be using it to determine any strengths and deficits that Daniel is presenting. Following those results, we can apply those directly to the ABLES-R to help develop a curriculum individual to Daniel and his specific needs, and we can use any of the tools that are used for assessment monitoring, and we can determine how much progress he's making over time.
The VB MAP stands for the Verbal Behavior Milestones Assessment and Placement Program. It is a tool used to assess and develop language and social skills in children, making it valuable for those with autism and communication challenges. It is composed of a milestones assessment that measures developmental milestones in language and social skills, a barriers assessment that identifies obstacles that may hinder learning, a transition assessment that assesses readiness for less restrictive environments. It also analyzes task analysis and supporting skills that break down complex skills for targeted instruction, as well as IEP goals that help develop personalized educational goals for the client. The VB map is primarily designed for children ages 0 to 4. The assessment contains 170 measurable learning and language milestones that are implemented across 3 developmental levels, including 0 to 18 months, 18 to 30 months, and 30 to 48 months. It covers important skills such as language, social, and academic skills. It uses both direct observation and testing and indirect methods, including parent and caregiver interviews. It has a demonstrated reliability of around 97%. And overall, there is strong validity evidence with stronger support in some areas and weaker support in others. The VB MAP scores provide relevant information for targeted behaviors, but some skills may not be fully represented based on their score. The results also suggest areas for improvement with the VB MAP assessment, including added detailed information on specific behaviors with certain skill categories, an assessment of complex communication skills, eliminating the potential for cultural bias, and the need for enhanced data collection methods to track progress over time. We will use the VB map to identify strengths and areas for growth by assessing the child's language, social, and learning skills, highlighting both strengths and areas needing improvement. We will also set individualized goals by creating personalized goals aligned with each child's unique needs, ensuring learning steps are achievable and meaningful. We will track progress over time through observation and adjusting goals and strategies as the child develops new skills. The VB map will also allow us to select targeted interventions that fit the child's learning milestones, making our support as effective as possible.
Here we are comparing the VB map versus the ABLES-R. The VB map is designed for ages 0 to 4, and the ABLES-R is designed for ages 0 to 12, although it's primarily uses for the children between the ages of 2 and 6. The VB map is composed of 5 components. It has the milestones, barriers, transitions assessment, along with the task analysis, supporting skills, placement, and IEP goals. The ABLES-R is composed of 2 components, the ABLES-R protocol and ABLES-R guide. The VB map focuses on verbal skills and communication skills, while the ABLES-R focuses on a wide range of skills, including language, academic, self-care, motor, and social interaction. The VB map assessment contains 170 measurable learning and language milestones that are implemented from 0 to 48 months, and it changes on the development. The ABLES-R is the assessment that is not developmentally sequenced and contains 544 skills across 25 different areas. The ABLES-R does not account for behavioral and sensory challenges. The next steps we take for Daniel is that we will be using both the ABLES-R and the VB map. We decided to use both because they help us identify the strengths and the weaknesses that are in Daniel's learning repertoire. We will know what programs are being successful and what programs are not being successful. We will then use the data that is collected to create a program that will benefit Daniel and his family in helping find ways for him to communicate. Here are our references.